Good afternoon. I want to welcome you to First-Centenary United Methodist Church. It's great to have you with us tonight. My name is Jason Gaddis. I serve as the senior pastor here at First-Centenary. It's an honor for us.
When the Sandy Hook school shooting happened, we really thought we were going to get something done then. Devastated when we didn't see progress at that time, but I'm really heartened to be able to re-engage on this issue with Voices for a Safer Tennessee, and part of our message tonight will be a message of hope because we are starting to see incremental progress that we do want to share with you all and to give some hope. So thank you all for joining us.
Now, before we get started, we have some, data and statistics that we want you guys to all keep in mind as we have this conversation. So the majority, 84% of U.S. adults say they have taken at least one precaution to protect themselves or their family from the possibility of gun violence. 58% have talked to their children or other family members about gun safety, and 41% have attended a gun safety class or practice shooting a gun. And we don't know the exact number of gun owners here in Tennessee because we don't require registration, but polls and indicating data show about 47 to 51% of Tennesseans have firearms in their homes. And according to CDC data, firearms are now the leading cause of death for U.S. children and teens ages 1 to 19, surpassing motor vehicle accidents and those caused by other injuries in 2020. So with that being said, my first question will be for Dr. Bhattacharya. You are personally working and you see the impacts of gun violence as a surgeon. Can you speak about the aspects of this issue that impacts your patients in our community specifically, and what are you hoping to change?
So I've been here for 8 years now, and there's been a continuous inflow of children through our emergency department, and I think it's actually gotten a little bit more increase over the last couple years. And we use the term gun violence, but it's really gun accidents, gun injuries, firearm injuries, because as I was talking in the green room, I think the last 3 children of gun shots that I've taken care of have been shot by their grandparent by accident, whether it's dropping a purse, getting a gun out of their pocket as they were going to clean it, or while they were cleaning it. And then I was going backwards. So one previous to that was by the brother, the one previous to that was by the father, and the one previous to that was by cousin. These were all accidental gun injuries by having weapons that are unsecured in your home that are loaded. No sooner would you leave a Ferrari in your driveway with the keys in it and maybe have a 12-year-old jump in it and drive 150 miles an hour down the interstate. I mean, weapons should be secured. They should be secured safely. I think the thought that these are injuries from drive-by shootings or somebody getting robbed at home, the injuries that I see, I would say, are 5 to 1 accidental injuries from weapons that are unsecured or improperly handled.
And is that something, as you talk about that, is that what you're seeing change with the rise in firearm deaths in children?
I don't know if more people are handling weapons more routinely, but it's probably more evenly split, unfortunately, between intentional or semi-intentional and accidental, but I think the accidentals in the last 2 to 3 years have dramatically increased.
Now, Lucy, the uptick in deaths from firearms is often blamed on our nation's current mental health crisis. Now, after any mass shooting, there is inevitably a call for mental health funding and access, but is this a fair assessment? And research has shown that only 4% of community violence is attributable to severe mental disorders. Why do you think the debate around firearms is such a challenging stigma? And would you address our mental health crisis? Would that solve our firearm crisis?
Yeah, it's a very interesting question that I think we could all be challenged to better understand. That the data of 4% kind of tells a story right there, that it's easy to conflate the mental health crisis with the firearm crisis, but they're two separate crises. There's no significant correlation of someone with a mental illness committing gun violence, that someone living with a mental illness might be more likely to be a victim of violence than they are a perpetrator. So it's something that we could all try to better understand.
Now, Erin, we were talking about some stats, and some of them are quite alarming about the rise in firearm deaths and how it's directly affecting Tennesseans and everyone here, and even Chattanooga. What does the data show as effective strategies for reducing some of those preventable firearm deaths?
Sure. And what I'll say, as a parent, the statistic that is most concerning for me is that firearms are now the #1 killer of children in Tennessee and the nation. And and we surpassed car accidents nationwide in 2020 for cause of death for children. In Tennessee, we reached that statistic 3 years earlier. So 2017, we are ahead of the curve in firearms becoming the #1 killer of children. Not a place we want to be. And so one of the challenges that we've found in how do we turn the tide, how do we actually change these outcomes we've seen, is we haven't had good data on how to do that, and there's a reason for it. So back in 1996, they actually passed a little-known federal budget amendment called the Dickey Amendment, and this put a freeze on federal-funded research on firearm violence, essentially. And as Dr. Bhattacharya probably knows better than anyone, the federal-funded research on health and injury and all that, they are the top funders. And so if they're not funding these causes of death, how to treat them, how to prevent them, we're going to get very little information and data and good studies on how to turn the tide. And so we had that freeze for over 20 years. In 2018, in a budget bill, they finally changed that. So now we are starting to see dollars flow. We are starting to finally see good studies on how do you prevent this rise in gun deaths and gun injury. And we've kind of now are starting to be able to formulate policies as a result that we know will make a difference. And there's no single law that on its own is going to end this public health crisis related to firearm deaths. But that taken together, there are things that we can do that can preserve the Second Amendment, but also reduce bad outcomes. And so this is really what Voices for a Safer Tennessee looked at when we were formulating our policy priorities, because we wanted to see what is evidence-based, but also what is feasible, what can get done in a Republican majority state that will have bipartisan support. And we landed on 3 key policy issues. And so first, that is expanded background checks with the goal of getting a universal background checks, meaning every single firearm transaction has to go through a background check. Right now, private sales, so any sale online, most sales at gun shows do not have to be subject to a background check. When you do have universal checks, that reduces homicide deaths in states that have it by about 13 to 15%. Second priority is temporary transfer laws, so that individuals, when they're in a period of crisis, you can temporarily remove their access to firearms through a court-ordered process if they are at risk of harming themselves or others. And we do that with due process, and when that's in place, we found that reduces suicides in states by as much as 14%. And it's also been used effectively. In a study of 6 states, they found it was used in 10% of the cases that they brought it forward on were threats of mass violence. So it can also be used to intervene effectively in threats of mass violence. The third priority that we have is secure storage of firearms. Dr. Bhattacharya's story just so clearly illustrated why we need that here in Tennessee and why people are increasingly getting access to these. And it's the reason we are #1 in the nation for firearms stolen from cars and #3 in the nation for accidental shootings by children. And so if we can pass laws related to that as well, data shows it does reduce death. So taken together, if we can make those changes, which we are incrementally working to do long term, we can save lives. And the Dickey Amendment is a great example of how a small policy change can actually have long-term implications. So that's why part of Safer Tennessee's mission is to achieve some of these incremental policy changes, but this time to save lives.
So Dave Bhattacharya, those solutions that Erin is talking about, the expanded background checks, the temporary transfer laws, and of course safe storage, do you think those could have impacts on the case that you're seeing and make a change?
Certainly. I think, not having children have access to weapons, not only in these accidental shootings, but unfortunately, specifically after COVID, we saw a dramatic increase in the number of children with self-harm, self-inflicted gunshot wounds, and children and adults struggle with mental health, and they certainly did during the COVID crisis. And this access to firearms, there was a large spate of self-inflicted gunshot wounds, which if they didn't have access to firearms so readily, then that would not have been possible. there's a lot we can do if a child overdoses or cuts themselves, but there's not a whole lot we can do when they inflict a gunshot wound upon themselves. Secondarily, children don't have the processing capability to understand that tomorrow is going to be a better day than today. And they get in these situations, whether it's social media, school, isolation, what have you, where they don't have the opportunity to think through their current situation, which adults do. I think one issue that, gunshots are the #1 cause of death, more than cancer, more than leukemia, more than the St. Jude commercials. It's the #1 cause of death in children 1 to 19. And the significant preponderance of that are children 13 to 18 with self-inflicted gunshot wounds. Guns kill by suicide more than any other mechanism. 52% of all people who die from a firearm die by their own hand.
And going off what you're saying, Dr. Bhattacharya, this is for you, Lucy, what he just said, what many people don't realize is that the majority of firearm deaths in Tennessee, 54 of them and nationwide, are actually suicide. So Tennessee has a firearm suicide rate that's nearly 50% higher than the national rate, and we are now in the top 10 states for youth suicide by firearm. In your profession, why are we seeing this rise in suicide, and are there effective suicide prevention solutions or protective factors?
Yeah, suicide and suicide prevention is a complex issue, but I think what we do know is that restricting access to lethal means when someone is experiencing suicidal ideations can be life-saving. That I've worked with a lot of kids and adults that are experiencing suicidal ideations and helped them get the right treatment that they needed and gone on to see them live healthy, happy, successful, productive lives, and the ability to not have lethal means in the home can be life-saving and get them to that next day that's better, that's brighter. And so prevention can be as simple as restricting access. It can be keeping in touch with your care providers. It can be, staying in a supportive network, letting people know what's going on. I think isolation can be detrimental, and suffering alone. And I think the ability to talk with your community about what's going on. So I think the fact that we're up here trying to build a safer community will play a role in that.
And Erin, what does the role of firearm access play in our suicide rates?
Sure. What y'all mentioned exactly that. Suicides are unfortunately the leading cause of firearm death. So most people don't think of they think of homicides and maybe even accidental shootings, but they don't realize that suicide is the leading cause. And in Tennessee, it disproportionately affects older white men, our veteran population, our youth. We're seeing a rise in youth firearm suicide now in the top 10 states for that. And it also disproportionately affects our rural counties. Too often, people see the firearm death issue as, well, this is just an urban problem. This only happens in Nashville, Chattanooga, Memphis. It's not going to happen in my hometown. The reality is that the suicide rate in East Tennessee, suicide rate in East Tennessee is double that than in the Memphis region. So this is affecting all of our counties, although what that gun violence issue or that firearm injury and death issue in that county may look like may differ a little bit based on the demographics. Why firearm access plays such an important role in suicide, a detrimental role obviously, is when someone does have access to a firearm, the likelihood of them, and they use it to commit suicide, attempt to commit suicide, there's a 90% completion rate there. Using any other means, it is less than 10%. And actually one thing that even Lucy was saying when we were having an earlier conversation about this is how individuals who, and Lucy, correct me if I'm wrong, if they, attempt suicide and, don't complete it, they are very unlikely to go on later on in life and actually die by suicide. So if we can keep them from having access to firearms, there's a very good chance they'll go on to live full, healthy lives. Tennessee, we have an access issue where criminals, those who are mentally ill, and children have too easy of an access for a few reasons. One goes back to a 2013 law we passed as an example. It's kind of called the Guns and Trunks Law. This allows you to store loaded firearms in unoccupied vehicles. The goal of that was to just keep drivers be able to drive safely to work and keep their firearm with them and leave it in their car when they go into the office building. unintended consequence is in 2013, we had less than 50 guns stolen from cars statewide. 2022, jump 10 years, over 5,000 guns stolen from cars statewide. So we went, from 50 a year to over 5,000 with the change in this law. So now we have it and those guns are falling into, most likely criminal hands, being used disproportionately with criminal purposes. With permitless carry that we passed in 2021, a lot more individuals now have their firearms on them, making it much easier, as Dr. Bhattacharya mentioned, when they're pulling it out to accidentally shoot someone. So the access issue, while there is definitely a component for public safety, we also have to think about how it is resulting in those who should not have access suddenly getting much easier access.
So we kind of talked about this a little bit earlier in the green room, but we are currently in the midst of Tennessee's legislative general session, and we have some kind of clarity of what may or may not be heard during the session. Dr. Bhattacharya and Erin, do you think anything meaningful will happen during the session in relation to firearm safety measures, and what should we be watching for that may signal a change in this sentiment?
Well, I was really excited to hear just before this something that I'd worked on starting about 2 years ago. But working with the Department of Education and the Department of Safety, our bill passed both the House and the Senate today and is up for the governor's signature for gun safety education in all public schools across the state, from Memphis to Mountain City. So kindergarten through 5th graders will be educated on how to approach guns. That doesn't mean that they're going to be taught how to fire guns. It doesn't mean anything other than they're hopefully going to treat guns almost like they would treat a fire. And that's, if you're thinking of something that you can take home to your own children, if you see a gun, treat it like a fire, get away from it, tell an adult, call 911, etc. But I'm really excited to see progress. So, turning problems into solutions, and we've already done that a little bit, and I think we have a long way to go. But I'm really enthusiastic that, this is a bipartisan effort, and we were able to get it through. So hopefully it will get signed.
Oh, that's terrific. Thank you. I'll share a little piece of advice on legislative change that I got from my boss, former Senator Bill Frist. And it's a quote he shared from Albert Einstein. And he said, "The most powerful force in the universe is compound interest." You're like, "Oh, what does that mean?" Really why I think of this is because it suggests that if we make small and seemingly insignificant changes, and we stick with them day after day, year after year, they have a cumulative, meaningful impact. And this is really how we have to approach this issue of improving firearm safety in our state. Meaningful legislative change takes time. Our lobbyists, so say for Tennessee, we have this wonderful group of lobbyists that are helping us advocate down during legislative session. And they're telling us, well, remember, wine in grocery stores took 7 years to pass. And who was against wine in grocery stores? Whereas, this is a much more contentious issue. And so for advocates, after Covenant, we had a number of folks who were really frustrated. Why didn't we see change immediately with the legislative session when we came back for special session that August? It's because it does take time, and we are seeing incremental change. For example, one of the reasons guns is no longer the number one killer of kids, guns are the number one killer of kids, is because cars are no longer, and it's because we've implemented laws over decades to also make our cars safer, right? So seatbelt laws, car seat laws, drunk driving laws, the requirement for backup cameras. Those have taken decades to put in place, and that's why you'll see the curve for child car deaths go down significantly. But didn't happen overnight. This is going to be a long-term process as well. And so we are passing some building block laws, hopefully this year, that will work towards these 3 policy changes that we talked through: expanded background checks, secure storage, temporary transfer laws. So what does this look like? So on expanding our background check system, there is a piece of legislation that is poised to pass. It just actually got funded in the governor's budget amendment, which was something we advocated for. It's called Jillian's Law. It would make those who are deemed incompetent to stand trial prohibited purchasers of firearms. It would also set up a process for involuntary committal for those who are incompetent and pose a threat to themselves or others. This law is important. It was in response to the tragic shooting of the Belmont University student Jillian Ludwig, happened this past November. An individual, he was deemed incompetent to stand trial. 12 days later, he was out on the streets, obtained a firearm, was just shooting at cars, tragically hit Jillian and killed her, and this individual should not have been able to legally possess firearms, and really should have been committed, and this law would put in place those processes so that can occur. Another change that we are working on that we've passed it through some key committees now is to make mass threats of violence, to criminalize those threats so that it is now a Class E felony. And we're also working to strengthen our background check system. We have a goal of getting to universal background checks, but we can't get there if we don't have a strong foundation. There was an important report that came out last year from the TBI. It showed we had a 761,000 record backlog in our background check system. So we can't have that work effectively if we aren't able to actually process this backlog that we already have. We worked with the governor's office. He approved funding in his budget that would help address this backlog, providing additional staff to do it, and we're working now to get that through the legislature in the final budget. So this is kind of what incremental change does look like. It's not as sexy as some of the big wins you might be as headline making, but this does build the foundation for long-term change. And the fact that legislators are having these conversations today and passing these types of laws is a testament to a shift that we are seeing, and that I think your voices are contributing to, so thank you.
So this question is for all of our panelists. What can the lovely people here with us right now and those watching at home, what can they do to take action, and how can they show their support for that legislation like you were talking about, Erin, and Dr. Bhattacharya? What can they do to show the support for those bills?
Sure, for those, please, reach out to your members. If you don't know who your legislator is, you can very easily find it on safertn.org. We've got it right up on our website. You can also go to the Tennessee General Assembly website and look up your representative. They've got easy ways to email and call them. You can also, of course, please vote. You'd be shocked to know that Tennessee has one of the lowest voter turnout rates in the nation, about 37%. So, it's not just voting in the big general elections. This means like showing up to the primary, showing up to the local election, because your local leaders become your state leaders, become your, federal leaders long term. So we need you there as well. But on those key pieces of legislation, yes, you can reach out now, and that is definitely helpful.
I was going to chime in. I think all of us who are parents, whenever we take our kids somewhere and let their buddy jump in the car, we make sure that they have a booster seat. It's not unreasonable when your kid goes for a play date to make sure that they don't have an unsecured weapon in their home, and I think it's awkward, but I think once we normalize that, once it becomes it's very normal to make sure, hey, do you have a booster seat? Can I borrow one? Do you need one? And once we make it very normal for us to discuss, do you have a gun in your home? Is it secured? It's not an indictment. I just want to know my kid's going over there. I think once we normalize that, and then talk to your friends about what Voices is doing. I think there's a perception maybe that trying to take away assault rifles or infringe upon the Second Amendment. We're being incredibly intentional to avoid any of that. We're talking about a problem and we're talking about a solution. We're not trying to infringe upon anybody.
Lucy, would you like to?
Yeah, and I guess I would just add, I think I was just going to say to safety sweep your own home, to make sure things that that need to be locked up are, and that we can be involved in, promoting public safety and respecting people that might have a diagnosis of mental illness, and that doesn't mean that person is going to, commit violence, and so to be able to respect those individuals at the same time being committed to public safety.
Now, did we have some questions from the audience?
And while we're looking for those, Lucy, I know you had mentioned earlier that there was also things that parents should be thinking about, preventative measures or just risks or flags that they should be thinking about for suicide, risk in children. What are some of those things that parents should, be paying attention to?
I think I would even think about the signs and symptoms that mental health symptoms might be exacerbated. That would be things like, behavior changes, mood changes, sleeping too much or too little, eating too much or too little, isolation. Any of those things might be signs and symptoms that a child might be struggling with mental health issues. And you might not be the one they want to talk to about it. You might be though. But if they're needing outside support to try to see and connect, there's a lot of really wonderful people in town that would love to be able to take care and support anyone's mental health.
I guess I'll give this out to all the panelists. Can you address some common arguments against firearm safety? For example, further gun instructions, as the good guys will not have firearms, but the bad guys will continue to find illegal ways to access them.
So what we have found is that the argument that if we just had more firearms in gun-free zones, that then we would be safer. When you look at the data, that's actually not the case. So for example, when police engage in an active shooting situation, they hit their mark about 18% of the time. So if you think of that, if you are then adding individuals who aren't doing training, who aren't experienced either in school policing or in other interventions, the likelihood that they're going to be successful in preventing a tragedy from occurring is not very likely, but we do see data showing that when you're adding firearms to these situations, there is much more likely for an accident to occur, much more likely for an argument, instead of it becoming a fist fight, becoming a deadly incident. So there's that argument against bringing it into gun-free zones. And then the idea that, well, criminals will always get their hands on guns, so there's no point in putting in additional regulations or rules. Again, the data has shown the opposite. So universal background checks is a great example, because you say, well, what's the point of doing universal background checks? Because a criminal is just not going to do a background check. He's just going to get the gun on the black market regardless. But you are adding an additional hurdle. You are making it that much harder for them to obtain the weapon, makes it more expensive, right? It's a harder commodity to get. And it's reducing homicides, firearm homicides in those states by 13 to 15% is the data we've seen. So these regulations or changes do make a difference. And further, the more states have them in place, the harder it gets. Right now it's patchwork nationwide. If we can expand that through Tennessee, we can help reduce access for those who should not have access.
So we have some audience questions here, and it looks like this one is for all of our panelists. Given that this is a public health crisis, what is/can be done to activate State Department of Health as well as Tennessee Academy of Pediatrics?
So the Tennessee Academy of Pediatrics is strongly behind this. There's a program that's enacted in all pediatricians' offices. If you go to your pediatrician's office, they have literature for you. The Children's Hospital of Erlanger, anybody who comes in, we're asking them about whether or not they have a firearm in their home. We provide free gun locks, which are provided to us through the Chattanooga Police Department. So everybody who's interested in having a free gun lock can get one either from the CPD or from the Children's Hospital at Erlanger. I think this is absolutely a public health crisis. I sit on the State Board of Health for trauma and trauma prevention, and we bring this up routinely. Our state board for trauma and our trauma prevention program has been funded historically by a tax on the tobacco sales. And interestingly, tobacco sales have fallen off dramatically due to policy. So our funding for that has changed, and interestingly, vaping and tobacco-related nicotine products are not taxed that way. So we're trying to change to get some better funding around that.
So one of our audience members wants to know, could we pass laws here in the city or in the county, for example, safe storage laws or red flag laws?
So firearms are subject to what's called preemption here in Tennessee. So that means city and local governments cannot set their own laws on firearms. It is subject to state level laws. There have been some members that have carried bills, particularly in Memphis this year, that did try to, because they are having a real disproportionate impact with firearm violence in the city there, to try and be able to set some of their own laws. For example, reinstituting permits for handgun carrying. Those have failed to date because of preemption.
Lucy, it looks like this one might be for you. You spoke about the mental health impact of victims and perpetrators. What would you say about the second-hand victims, kids who are suffering from the anxiety of these shootings?
Oh, I think that's such a great insight. Yeah, and so vicarious trauma, your body doesn't know the difference. You experience it as if you are the person that's experiencing the firsthand trauma. And so I think that it's a real issue that we have to look at as mental health providers and as community members, of how we can take better care of our kids in schools and in communities to where they don't have to carry that fear that shouldn't be theirs to carry. And so I think that looking at in each case individually of what the anxiety would be presenting as, I would be able to better answer that in those moments. But I do think it is a call to action to be able to, I know mental health education is being integrated into schools with school-based counselors, being at the ready to speak to kids that might be struggling. And so I would, on the school level, to look at what resources might already be in place, and on the community level to see what resources could also be supportive to the kids.
And Erin, can you please discuss the argument that safe storage, securing of guns infringes on Second Amendment rights to ready access?
Sorry, Second Amendment rights to ready access.
Yeah, so discuss the argument that safe storage, securing of guns infringes on the Second Amendment right.
Sure. And to be clear, Voices for a Safer Tennessee, we support the Second Amendment. We are not looking to infringe on anyone's rights. But with any right comes great responsibility. And with all of our First, Second Amendments, all of our amendment rights, it's clear that when public safety is at risk, that you can put certain barriers in place to protect public safety. And the same reason that you cannot go into a crowded theater and yell fire, right? Or with the Second Amendment, there's a reason we can't go in and purchase a bazooka or a machine gun. It's because public safety is ultimately at risk, and so there are limitations that we can put in place there. So with secure storage, there are ways to be able to readily access your firearm while also, in your home. You can do that with a fingerprint safe. Those can unlock in seconds, and keeping it locked so that your kids can also not access it. Same thing if it's on your person. If you're properly storing it on your purses and locked versus just leaving it unlocked in the glove compartment of your car, for example. That is a safer situation. So we recognize it is a issue that we do have more education to do here. I know we've done some polling on it. The vast majority of Republican voters support the concept of secure storage, but when we put in place the idea of penalties for failing to secure your firearm, then the support starts to drop. So we have to figure out, how do we best achieve behavior change there? One thing we are excited about, after special session, one of the things they did pass during that was $1 million campaign to encourage secure firearm storage. Department of Safety is putting that campaign together now. It should be rolling out soon. And we are hoping kind of some of that messaging will help change individual behavior so that they aren't leaving accessible firearms in places that where others can easily access and get hurt.
And this kind of picks up where you were going with that. Somebody wants to know, are there any specific bills that they should be aware of right now that they need to call their legislators to either support or oppose?
Sure, I'm going to say yes, and I'm going to take a quick sip of water first. For some reason, my mouth is just really dry right now. Apologies. I'm going to blame it on seasonal allergies.
The pollen's getting to all of us.
Yes, it's affecting us all, the pollen. So there's a couple bills. So yes, Jillian's Law that I mentioned, that is HB 1640. We strongly support that bill. It'll be coming up soon. We don't have the exact dates yet for House or Senate floor votes, but encourage your members to support that bill. Another bill that we are excited about that is still kind of moving through the committee process, HB 1600. These all have Senate companions, but I just have the House number easier off the top of my head right now. But what it does, it would make those who have criminal juvenile records, who have kind of violent criminal records that would have made them prohibited purchasers as adults if they had committed these acts when they were adults, but if they did them as juveniles, or they had a mental health adjudication as a juvenile, they were committed as a juvenile for mental health reasons, they would be prohibited from possessing or purchasing a firearm until age 25. And so this is what HB 1600 does. We're excited about this bill. It has the potential then to keep firearms out of the hands of those who are more likely to pose a risk to themselves or their community. And we know that ages 18 to 20 are the age most likely to commit firearm homicide. They're at a higher risk of firearm suicide. And Dr. Bhattacharya probably knows much better than I do. And same with Lucy, the front of your frontal lobe of your brain is still developing during those years, so your decision making is not as sound. So this is a good kind of delaying mechanism. Another bill that we are monitoring right now that we have concerns about, that we shared about on, actually issued a statement about yesterday, is SB 2502. This bill would allow individuals to openly carry loaded long guns, including semi-automatic weapons in public places and crowded spaces. And so any place that they are currently allowed to carry, they would be able to carry now a loaded long gun. Bill we are seriously concerned about and are working on now.
And kind of talking about those bills, somebody wants to know, where do you stand on the Tennessee bill moving through the legislature on arming teachers and school staff?
Sure. So this is a bill, it's made a lot of headlines, right? You hear it as the arming teacher bill. It's a little bit more nuanced than that. At the front end, Safer Tennessee, our position is we always feel that adding guns to gun-free zones never makes people safer. Hard stop. But I'll explain kind of how this bill works specifically. You hear the title and you think, okay, now every teacher and faculty member can now bring a firearm into school, right? That's actually not how it works. It does have a number of requirements for these individuals to meet to be able to carry in a school setting. So they would have to go through an extensive background check with fingerprinting, be subject to a mental health evaluation that is the same that a member of law enforcement would receive, and they have to do 40 hours of annual school policing training at their own expense, and then also get a letter from the chief of the local law enforcement agency confirming that they are a good candidate to do this. So there are a number of steps these individuals have to meet. So a very small few folks would actually probably qualify, particularly if it's required with a 40-hour training requirement every year. And so it's something that the Department of Safety, TBI, the Sheriff's Association, they all worked with the sponsor of that bill to add these safety provisions in place so that really only the most trusted individuals who have at least done some extensive training and a background check would ultimately be able to bring a firearm in.
Erin, I know we've been having you answer a lot of these questions.
Sure,
so I'm
okay.
Say this one is for all the panelists. Are you aware of the Be Smart organization that helps promote secure storage, gun safety for our children? They said it's a program for adults.
I think that's what I was referencing to with the AAP-backed program. That's the Be Smart program. So it's a fantastic program, and I've worked with their founders or local liaisons for the last several years. So,
did you want to add something, Lucy?
No, I wasn't aware of it. Glad to know that it exists.
And someone wants to know, I know you touched on this, Erin, so maybe you guys want to jump in here, but how should parents keep teens away from locked up guns? They say if the teens, they'll find a key or they'll find a combination. What are things that parents can do to keep their teens away?
I think biometric safes, and then the other thing which we use in our home is, it's not guns, it's bullets that hurt children. So, having your gun and your bullets stored separately, or not even keeping them in the home as we do. So if I go shoot, and I literally throw the ammunition in the trash can, or I give it away when I'm done, but there's no live ammunition in our home.
Erin, this is another question for you.
Yeah.
Is Voices prioritizing types of firearm safety measures, i.e. assault rifles versus handgun purchases, and background checks?
Sure. So all the our 3 policy priorities are what I outlined, and any policy priority that we are going to be advocating for, we want to make sure that it has bipartisan support, and in a Republican majority state, that it also has the majority support of Republican voters here as well. And the reason for that is because we want to work on what is possible to actually get across the finish line, and that has really helped us build a broad coalition of Republicans, Democrats, independents, hunters, veterans, military families, educators, all, folks in the medical community to be a part of our organization, because they can all agree on these 3 safety measures. Once we start adding in any policies that maybe only appeal to one part of our coalition, it makes it much harder for us to get things across the line and maintain this really unique Tennessee-led, Tennessee-founded, diverse group together. And so we are focusing on what has bipartisan support, and we can actually, can get across the finish line.
So I think we've gotten through all of our audience questions as of now, and we talked about a lot. We've heard a lot of statistics and experiences, as Dr. Bhattacharya has talked about, Lucy and Erin. So this question is for all of you. In our state, what gives you hope in your work?
I think seeing people come together like you guys have and people have across the state for the last at least year that I know of, since the memorial of our horrible event, seeing people from both sides of the aisle work together to find a solution, it's incredible. I didn't know that I've been harping on this for a long time, and to see things finally come together is incredible.
Yeah, I think in my work I get to sit across from a lot of people having a hard time, and with that I do see people get better, and I think the fact that that can happen gives me a lot of hope, and so that's I guess my message to share.
Sure. So I shared before that I was in Congress when the 2012 Sandy Hook shooting happened, and how devastating that was, and how the fact that we got nothing passed after that was so heartbreaking. And then, as you all obviously have seen, we've had more and more of these mass shooting incidents, and it seems like an action after every single event. And then I'll fast forward to 2022, you had the Uvalde school shooting, and I think this points to a shift where we can actually see some hope, because we had Republicans and Democrats come together in Congress, led actually by a Republican senator from Texas, and pass what is the most significant piece of federal firearm safety legislation we've seen in nearly 30 years. It's called the Bipartisan Safer Communities Act. And did it solve all our problems? Certainly not. We're still here having this conversation today, but it points to a shift. And then last year, after Covenant, absolutely horrific. And we had Governor Lee, who is one of our strongest Second Amendment governors we've ever had, pause and call for something different. He called for an order of protection law, which is essentially a temporary transfer law. And when that didn't pass, he called members back for special session on public safety, and we got some incremental progress done. And now lawmakers are having more constructive conversations about firearm safety. We're having them in, when we are going into the members' offices, we're seeing bills like Jillian's Law move ahead, and that gives me real reason for hope. It's not going to happen overnight, but I really do think we are at a tipping point for change. But we're only going to keep seeing this progress if we have folks like you who are showing up not just in this first year after a tragedy or after your community's been impacted. I know Chattanooga has been disproportionately affected by the shooting of Chris Wright. There is legislation that's also moving there, led by Representative Hazelwood and Senator Watson, that would essentially increase If an individual has had multiple misdemeanors, after that 5th misdemeanor, if they get one more, it becomes a felony, and that would then make them a prohibited purchaser of firearms, because I believe the individual who was in Chris Wright's case, he had numerous misdemeanors, no felonies, and he had access to firearms. So this is incremental change in response to these horrific events, and if we keep coming back and adding our voice, our lawmakers will listen, and we will ultimately, in the years to come, see progress.
Well, I want to wrap this up by saying thank you to each of our panelists for being here and fostering this conversation and giving us your expertise. And of course, thank you to Voices for a Safer Tennessee for bringing this conversation to our community. I think, it's an important topic. We've heard a lot and really dug into it. And so I want to pass it back to Reverend Will, if he's around the corner. And of course, thank you to all of you for being here and taking part in this conversation as well.
Cornelia, Lucy, Dave, Erin, thank you all so much for sharing your hearts and for helping bring us together in civil dialogue. One of the things that I loved that Erin, you shared was about the compound interest, and in my mind was the effect that a ripple can have in a pond, in a stream, and how maybe we could be positive ripples in our states and in our city. And Dave, one of the things you mentioned about just having the courage to talk about gun safety. As a father of 2 young boys, I know that there's going to be times when they're going to be going to a friend's house, and I need to be able to have the courage to say, hey, do you have firearms? Are they secure? I need to be comfortable sharing that I have a gun in my house and that it is sealed with a biometric safe, and comfortable when somebody asks me that, and to begin to break down those stigmas. So thank you for bringing those aspects to our attention. My hope is that we will continue to be that positive ripple in the world to keep our kids and our communities safe. I'm going to pass it to Dory, who's going to share some information about next steps and how we can do that.
Thank you so much to all of y'all, so appreciate it. Thank you to the church, to Will, to everyone, and thank you so much for all of you being here. So I think I love the question you ended on, Cornelia, because your question of hope and what gives you hope. And as we sit here in this sanctuary where we just a few days celebrated Easter, I feel like this journey that I've been on for the past year with Voices for a Safer Tennessee is not often full of hope, and that it's really hard. It's a marathon, it's not a sprint. I keep reminding myself of that when I get discouraged with the bills that Erin talked about that are all so disheartening. But I do feel hopeful right now, and I feel the fact that in Tennessee we can form a statewide coalition of almost 30,000 people who can come together and find some common ground on this is hopeful. And that's why I'm a part of Voices for a Safer Tennessee. I appreciate the way that this organization has gone about doing this. We don't get in your face and scream at you and tell you that your opinions are wrong. We value everyone's opinion. We will want to sit down and have a persistent diplomatic conversation with you. We want to keep trying. We may find 30 seconds of common ground the first time, but the next time we might find 30 minutes. So we just want to keep working at this, and that's what we need your help in doing. So if you haven't already, please sign up to be a part of the Voices for a Safer Tennessee Coalition on our website, safertennessee.org. Tell your networks, talk to your friends. These are hard conversations, so once you do, pat yourself on the back. It's not easy to walk into a group of friends and be like, hey, do y'all have guns? Are they secure? But these are all things that we can be doing to help our state be a safer place. Thank you so much for being here. I'm happy to answer any questions, but these are the real stars and have all the great knowledge, and I'm sure they'd be happy to answer any questions as well. Also, feel free to grab a yard sign on your way out, or 2 if you have a friend that you couldn't be here tonight and would like one as well. And we so appreciate your support. Thank you.